taping, correct? What sort of taping is the next question that one has to ask. Because taping is not just taping, okay? It depends upon how it's applied. Okay, anyway, let me just go through a bit of a presentation that I've done. It's covering DermoTaping. So there are two concepts. DermoTaping is specific for skin and connective tissue related problems, whereas neuromuscular taping is for rehabilitation in a physical therapy or speech therapy, nursing, occupational therapy, medical area. So the base concept is the same. Of course, we're applying a tape, which is creating dilation, but the professional competency and medical competency is different, okay? So it's a question of what sort of patient you have and what is your objective in those treatments, okay? Okay, so when we talk about tape, we must talk about the methodology, how it is applied, because the tape itself has no pharmacological action. It has a mechanical action because it is a tape stuck on the skin. And so consequently, how you apply the tape obviously is the key. It's not a product-related question, because there are many products, more or less they are the same, more or less. And so it is a quality issue of the product and not a action related to the product itself. So we're going to talk lymphatic drainage and blood circulation. These are some images that was done several years ago for Gemelli Hospital for a calendar for mastectomy. So women who had mastectomy, and so we're just using the tape together with this aesthetic style of normalization after oncology surgery. And so it's just a way of showing some of the typical applications of dermotaping or neuromuscular taping. And as you saw, the tape is cut into single strips and they are applied in a longitudinal direction. And most importantly, as you see in the photograph here, the tape is wrinkling. To create a dilation mechanical action, the tape has to wrinkle, which means it is accentuating the wrinkling, the physiological wrinkling of our skin, which is accentuated through movement. Anti-aging or skin tightening, which means we're not going to pull a tape and make the skin tighter. We are going to improve the oxygenation and fluidification of the skin. So consequently, the skin tone is going to improve, which consequently means that the skin looks tighter, but it is not compressed. It is improved health of the skin. Muscular taping is offering a different action, which is opposite to compression, obvious action. So modifying the pressure is our objective, to modify the pressure, not to increase the pressure. So we can also look at dermotaping or neuromuscular taping as a system which creates negative pressure. So if we have lymphatic vessels, as we have here, if you apply a tape which is stretched, elongation, stretching on the skin, the obvious action in depth is going to be compression action. So it's going to squeeze, it's going to lymphatic vessels and that lymphatic node. But that is half the story, obviously, because the other half of the story is to create the dilation of that lymphatic node, which is created through a tape ondulation or tape waveform. So when we apply a tape, what you see as a waveform creates dilation, because when you touch it on the outside, you will feel that the area is softer. Softer skin, softer connective tissue, softer muscle fascia, muscle itself, which is around the lymphatic system or vascular system. So consequently, in medicine, in anything really in the world, we have two opposites, okay? And so this is what Chinese medicine has always brought us, is two opposites. Nothing can exist without both of them being obviously present at the same time. And so my background is in acupuncture and Chinese medicine. And so learning a certain taping technique in 1999, okay, it seemed to be interesting, but the tape at that time was only a stretch tape, which is called kinesiotaping. Kinesiotaping is a stretch technique. And so there was something there, but obviously it's half the story. A compression tape is not very useful in a stroke patient, for example, or in a Parkinson's patient, or in a post-surgery patient. So my way of looking at health, or Chinese medicine way of looking at health, is there are two opposites. So what I did is I just explored, how do we create a decompression taping application, which is opposite from a compression taping application. And that means applying a tape which creates an eccentric stimulus, which is opposite to a concentric stimulus. And to create an eccentric stimulation, you apply 0% tension. Where it's concentric, you apply variable tension levels, but zero or tension, and these are also opposite. So we have one which is compression, obvious compression. The other is obvious decompression. And the difference is the wave pattern on the tape, and the wave indicates a tape which is eccentric. So the elevation effect on the skin is our key. So for example, in this case, we have the armpit, anterior armpit, auxiliary area. You see here with the arm in a neutral position, there's some wrinkle. Obviously, putting the arm to a flex position, anterior, the tape is going to wrinkle more. In an extended position, it's not going to wrinkle. So consequently, through flexion, extension, we are going to continuously modify the local pressure, which is going to facilitate the movement of the lymphatic fluid, because lymphatic fluid moves because of a modification of pressure, and it is not static but obviously dynamic. Also here, okay, this is just a short film that I did, okay, on the application of the tape and its activation, in this case through just a aqua gym. So you see how the tape is on the abdominal area, in the inguinal area, in the buttocks area in this case, and so consequently through flexion and extension, Okay, obviously this girl has no edema problem, okay, but it's just a film to indicate how the tape is activated through movement. Movement can be in a gym, movement can be just walking up and down the beach, or if you don't have a beach, okay, in the park, or in an aqua gym, or in a gym anyway. So, and also you see here, if we want to help modulate the connective tissue, in a certain area of the body, whether it be in the hips area, abdominal area, or in the buttocks area, which means we want to encourage the lymphatic drainage, encourage the blood circulation, oxygenation, nutrition. Consequently, both skin, connective tissue, and muscle tone will increase. Okay. So, as you see here, okay, we know the lymphatic anatomy. And so consequently, our anterior auxiliary armpit area is a key area for the upper extremity. And so this is a typical dermal taping, neuromuscular taping, lymphatic application. You see here with the arm in a slightly anterior position, how the tape is wrinkling, and so consequently creating negative pressure over our also object. Here in the inguinal area, obviously the inguinal lymphatic nodes are our key. Okay, also here is an example of this is a base treatment that we'll be doing during the course. So our objective is a lymphatic inguinal. Consequently, in neutral position, supine position, or in hip flex position, you see how the tape is obviously wrinkling. Okay. More volume to drain means more strips of tape. More volume does not mean wider tape. It means still 1 centimeter strip, 1 centimeter distance between each one of the strip, and this is an example of 50% of surface area which has been covered. 50% of surface area. Okay, so 50% means 1 centimeter tape, 1 centimeter distance. More volume, more strips. So the eccentric action created by the tape, which is then activated through normal movement or manual mobilization, okay, is going to facilitate the dilation and constriction of the circulatory lymphatic system. But don't forget, the major problems that we have in front of us is due to excessive constriction. So consequently, the therapy has to be not the same, but the opposite. And so decompression elastic methodology was created here in Italy. I created it in year 2000, 2003. So creation means skin elastic features, okay, maximum lines of skin elasticity, as I outlined before, but also we have a range of elastic action, which means over a joint, we have the skin which has a maximum line, but also has a range of elasticity due to the underlying rotation of the joint, or flexion, extension, and inversion, eversion of the joints. So these lines are pretty simple. They are not Langer lines of skin reduced elasticity. These are lines of maximum skin elasticity, and they are based upon observation of a living body, not of dead bodies. Okay, and so she is alive. And so aging lines indicate lines of minimum skin elasticity. So the line on the forehead is horizontal, which means the line of skin elasticity is longitudinal. Around the mouth, you have typical aging lines, which are perpendicular to the lip, but the muscle fiber is around orbicularis of the mouth. So to treat those lines, you have to apply a tape which are going perpendicular to the aging lines. And so this is going to be one way of you to remember or to understand in what direction you apply the tape. For example, oncology rehabilitation. So here is not just aesthetic, but it is also obviously functional. So there are various objectives, okay, in a patient confronting first cancer, the surgery of cancer, the chemotherapy, radiotherapy, and to outlive the cancer itself. So our objectives is to enhance the quality of life. So sometimes there is very precise surgery, minimal surgery, and so sometimes there is very invasive surgery. And some of the worst surgery, or some of the most invasive surgery, let's say, on the breast I've seen is in New York, also in Australia. Target areas, okay, can be in the breast area, but also in the throat, thyroid, neck, face, lung cancer. So we have lung, thoracic surgery. We have the upper back area, the groin area, the genital area, etc. And so we are going to be treating both scar adhesion. We're going to be treating the edema. We're treating the neuropathy caused by chemotherapy or radiotherapy. So specifically with breast surgery, okay, sometimes the body does not respond how it should, and so creating nocicolloids, for example, in this case, in this reconstruction of the nipple, and so consequently we are treating to improve the elasticity. And so here, as you can see, there are different widths of the tape. So different widths of the tape for you who have already done the course means different objectives. So we have sensory objective, we have a vascular objective, we have lymphatic or functional objective. And so consequently, the choice of width of the tape depends upon what is your objective, okay? So, for example, in this case, one is for a webbing syndrome, the other is due to invasive mastectomy with lots of very adhesive scarring. And so sometimes it's difficult to see where the breast was, okay? And so we have to understand the lines of maximum skin elasticity, and that is a correct application, as we see there. Obviously, sometimes in lymphatic area, we have limb, which has excessive edema. So consequently, we obviously have to have a combined therapeutic approach. And so consequently, we can have a compression bandage, which is obviously going to be distal or proximal. It's going to be distal. And we're going to have a neuromuscular taping decompression action, which is going to be proximal. So compression, distal, decompression, proximal is the obvious approach for primary lymphatic conditions, or for very excessive edema in the upper or lower extremity. Medical cosmetic surgery, okay, obviously the surgeon does it all for you, but the surgery also creates scarring, pain, reduced healing processes, non-symmetrical results, and non-bilateral results. And so consequently, okay, we can apply neuromuscular taping to improve the overall result, treating the hematoma, treating the edema, improving the sensibility in the normalization of the sensibility in the areas, okay. Also body, whether they be face or body processes. And so, for example, she did everything. She did the breast, she did tummy, okay, she did the hip, okay, she did everything. And this is 18 months after, and she feels pretty tight. The skin is very shiny. A shiny skin is not a healthy skin. A shiny, stretched skin is not a healthy skin. Relied for muscular tension, for improving blood circulation, nutrition, oxygenation. And so consequently, if you want to create more form or to treat a specific area, to create that inferior gluteus buttocks line to be more accentuated, okay, we're going to do that by improving the skin elasticity and by helping drain that specific area. Abdominal area in body applications is fundamental. Okay.